Hello everyone, I am Dr. Deepthi Thakkar, General and Bariatric Surgeon at Live Life Hospitals, Hyderabad. Today we are talking about obesity and bariatric surgery. So we have seen till now BMI, when to decide that you need to lose weight, what are the different options, non-surgical options, what is gastric sleeve, what is gastric balloon. Now we come to the patients who have BMI which is above 40, 45, 50, which means that these patients have about 50, 60, even 100 kilos of excess weight that they have to lose. Or those who have very high uncontrolled diabetes. For such patients, there is a different surgery which is called as the gastric bypass surgery. Why bypass? Basically, only sleeve does not help such patients in losing complete weight and maintaining that weight. That is where we have to add a bypass. Now our intestine, the small intestine, is about 600 centimeters. So what we do in a gastric bypass is two things. In the first part, the stomach is reduced, as I explained in sleeve. In the second part of the small intestine is like a pipe. Part of it is bypassed. Now you can imagine if you have gone through any flyover or any bypass, you can imagine that now the food is going to bypass certain length and reach the next point directly. Some part of the intestine will not receive any food. The small intestine is like a sponge. Whatever you give it, it will absorb. So if you can imagine that we are now separating half of the sponge. So only half of the amount of food that you eat is going to be absorbed, which helps in losing weight, which also has some positive effects on the insulin regulating mechanism or sugar regulating mechanism, and which helps in control of diabetes. Now there are different types of bypasses which are there. We have the Roux-en-Y gastric bypass, we have the one anastomosis gastric bypass, we have the proximal jejunal bypass. There are many different types. Depending on what you need, what is your excess weight, what are your medical issues, depending on that we decide which bypass is most suited for you. Because we are partly removing intestine from the path of absorption, we are not removing any intestine from the body, it is still in your body, but it now is no longer absorbing anything. Bypasses do cause certain malabsorption, which means that because even if you may be eating all the healthy food possible and you may be taking all the vitamins and supplements as advised, everything is not going to get absorbed in your body because part of it is not going to that intestine. So in patients with bypass, there is this small risk of malabsorption, which is why they are always advised higher than normal dose of multivitamins, iron, calcium, etc. This is something that patients with bypass have to do very regularly. A sleeve patient doesn't need so much insistence on vitamins because they have only a smaller stomach, but there is no change in their absorption or digestion. So this is a small difference in bypass where we don't consider it for everyone. It is only considered in very specific patients, and they have to take that little extra care lifelong so that they can maintain their vitamin levels, their stamina, and they don't get into different problems of malabsorption like weakness. So this is something that is important. If you have questions whether or not you are suited for sleeve or bypass or non-surgical techniques of weight loss, you can meet me at Live Life Hospitals, Hyderabad.